Richard Skeever from Sci Management Rights. COVID-19 has impacted everyone, and as management rights owners, we need to know how important security and safety is for your management team, contractors and residents of the building. We will cover some key aspects that you may consider implementing to help you through this challenging time. This is a guide only and does not override the official authority announcements, laws and advice that is being or will be provided by the government. Firstly, we will cover identifying and isolation of residents. If a resident advises you or your team that they are not feeling well or displaying flu symptoms, then the residents need to be self-isolating in their unit. And they should not engage with other residents or have any visitors. They should not be using any of the common area building facilities. You should keep a register of residents who are self-isolating and notify your team who should be self-isolating so that your team can monitor this and report to the authority if the resident is not complying with the self-isolation requirements. Your team shouldn't be performing routine inspections either, as this will significantly reduce the risk of exposure to the virus. Entering into a resident's unit must only be done if it is absolutely necessary. If it is a non-urgent job and can wait, then it shouldn't be done now. However, there will be situations where an urgent requirement to enter a resident's unit must be done. Before entering the unit, you need to confirm if the residents of the unit are self-isolating and if they are not feeling well. You should not enter the unit if they are feeling unwell or are self-isolating. You need to ensure you and your team avoid contact with other people. Stay at least 1.5 meters from others, including team members. Wear face masks, wash hands before and after putting gloves on, and do not touch anything inside the unit without gloves. And also wash your hands after disposing the gloves. Another aspect we will cover is effective communication. If a resident requires isolation, it may cause a disturbance in the building and may reduce the efficiency of operations. If the incident is not managed effectively, it may result in negative publicity, which could affect the building's reputation. At all times you will need to respect the resident's privacy, so you should not disclose any of this information to anyone unless you are required to by law, such as the name of the resident and their unit numbers. Thank you for watching. Hopefully there was something useful for you to implement in your building. Just remember, if you're thinking of buying or selling management rights, please call 0404 331 310. Thank you.
This virus, called 2019 nCoV, is new and we are still learning about it. From what we know now, it can make some people a little sick with a slight runny nose. Other people get more sick and can have difficulty breathing and develop pneumonia. Some people get very sick and need to be hospitalized. Among those, unfortunately, some have died. While we still need to learn more about how the disease affects people, thus far, most of those that died had other underlying health issues. This information will change as we learn more about this disease. WHO will continue to provide updates as more information becomes available. If you need more information on the new coronavirus, check the WHO website at who.int.